everyone. We're super excited to be here tonight. This is our first podcast with Dr. Mike, the Lung Doc. We're excited to start bringing a series of podcasts to you, interviewing intriguing and interesting individuals who have had either an impact on medicine in Chattanooga, or medicine anywhere, or are unique individuals that offer something unique that we have to tell their story. And I've had the opportunity to cross paths with many great people, including physicians, that I have invited to come here, and we're super excited to have our first person who's making an impact here in Chattanooga. Dr. Jim Bush, an interventional radiologist, is here with us tonight, and we look forward to talking to him about his background, how he got here, and where you're from. Welcome, Jim.
Mike, thanks for having me. It's good to be here.
Cool.
It's good to be the first.
Always first, and we're hopefully we'll get into that because I know you got a lot of firsts that we'd like to talk about. So, talking about, as we introduce you here, before we get started, I want people to know what an impact you had on our practice here. You know, we came into Chattanooga. I have a passion for pulmonary, for helping people breathe better again. I came from Houston, Texas, where I did all my training, Baylor College of Medicine. And for various fortunate events, we wound up here, and super excited to be in Chattanooga, and I'm hanging up my shingle to start my own private practice in pulmonary medicine. And I remember being scared to death. I had no patients. I had no office. I was looking around for a place to have a desk and exam rooms, and we were introduced to each other by a mutual colleague, and fortunately, you had space available in your building here with your radiology group with a cardiologist who happened to leave town. Mm-hmm. And so I just remember having a conversation with you about how we're private practice doctors. And I was honest with you, and I said, listen, I'm just starting off. I have no money. I have no patients. I need 2 exam rooms and office, which you had available. I said, can we work that into some way in my lease that I can pay it off over time? And you extended the opportunity to me to say, yeah, that's something that really we can do. That's doable. That allowed me some breathing room to open up my shop. And I remember sitting in this office right here with a plastic Costco fold-out table, 2 plastic chairs. My first hire was my practice manager, she's with us today. And I remember Wendy sitting here on that chair with her own laptop. And she tells a story now, 10 years later, how she felt more that she said, well, I'm just going to have to help this pathetic doctor. There's no way he's going to survive 3 months. So she said, I'm going to help him out, just get things set up, but I don't expect much from him. But I had a passion and a drive to be successful, to be independent, and to deliver quality pulmonary care. And after about 3 to 4 months, I had a growing census of patients, and paid back the support you gave me, and we've been going forward ever since. We're going on 10 years now, I think, and now we have nicer furniture.
You do?
State-of-the-art equipment, and delivering state-of-the-art quality care, pulmonary, with your help with our patients. And I just want to say thank you. I appreciate that very much.
Sure.
That's the kind of guy Jim Bush is that we're going to be talking to tonight.
That's awesome to be here. It's really cool. It's a good story, Mike. I love it.
And your kind of origin story that we'll talk about a little bit is like how you grew up in Chattanooga, right? And how'd you wind up leaving Chattanooga to go off to do what you did to get ready for medical school?
Well, I grew up on Signal Mountain, which is Chattanooga, basically. Yeah. Chattanooga was a very different place in the late 70s and 80s, as you probably know. Walter Cronkite dubbed it the dirtiest city.
Chattanooga, like in the 70s, the most polluted city ever.
In the country, yeah. Pretty famous footage. And so that's not why I left, but went to high school here, had a good education, went off to college in Jackson, Mississippi.
Mm-hmm.
Millsaps College.
You also had, you vacationed quite a bit with your dad out in the Carolinas, is that right?
That's correct. I think I know where you're going with
You're a big sailboat guy, right?
Yeah. So when I was in high school here, we used to we had a place in Seabrook Island, which is just south of Charleston, South Carolina, and we would spend a lot of time during the summers there. We had a place, or Dad had a place, and Mom, and we had a Hobie cat. So I'd spend a lot of time sailing every single day for about a month or two. So it was a lot of fun. There were a lot of kids running around down there, so that was also a lot of fun.
And you're not the type of person who likes to just do it on smooth, sunny sailing days, right? Did you,
No.
The best time to Hobie Cat is when?
Tropical depression.
Tropical depression, right?
I'm not sure it was good, but it was exciting.
We've had get a little airborne, I guess, right?
There is. I've done that before, so I'm sure you've heard the story where this was just pre-storm, big winds, and we would have fun sometimes and go over a sandbar, and hopefully it's deep enough but the waves crest, so you can launch the boat and get completely out of the water
and get over the sandbar.
Well, no, just and land back in the water. But unfortunately, one time it was with my father.
Yeah.
We landed and the water wasn't deep enough, and we drove the rudder right into the sandbar, and then the boat snaps to the side and then popped it right off the back. And so we're out in the middle of the ocean
in a storm,
and just cracked the rudder off the back. So. And we're standing there because the whole boat's just wrecked, and I'm up to my shins in water and looking around going, oh boy. And so basically what we did is we flipped the boat around to take one tack on the hull that was still intact with the rudder that had not fallen off, and just pointed it in that direction and just went all the way back to the shore.
One hull lifted
all
up
the
and
way
just
in.
sailed a straight line until you hit shore.
It was really cool.
So then how did you wind up you go through Signal Mountain, you're finishing up high school. What made you decide to pursue, what college you want to go, and how did that influence your pursuit of going into medical school?
It's a good question. And my father's a physician. He's a radiologist, and he is a very cutting-edge type of radiologist, as you well know. World expert now in prostate.
And he practices here now.
He does. Yeah, exactly. So he is a very good salesman. So when I was in high school, I had a lot of interest in medicine, and I would follow him to the hospital and get a sense of what he did. And I was very fascinated with the science of medicine and then helping people.
Right.
Helping people was probably the primary piece of it that, later I learned the science of it all.
Right.
But it was the part that fascinated me the most. And it was also a challenge. I always enjoyed a challenge.
Your father recalls a story when I interviewed him in preparation for this about how he said to me, and you may not know this, he thought one of the most unique characteristics that you have is that, particularly in your sailing days and growing up, is that you could talk to anybody. And I said, and I almost laughed because I said, well, Joe, so can you. But he said whether the person was 8 years old or 80 years old, you always knew how to strike up a conversation with them. And is that just inherent in you, and that was part of, did you learn that like on the beaches in Carolina, or did you learn that you're just innate in you?
Well, I'm sure some of it's genetic then, if it must be, or nature nurture kind of thing, based upon my father having that same trait. But it's always a way to try to relate to folks. It's something that helps me a lot in medicine, trying to take care of patients. You quickly need to develop some level of rapport with your patients, and it translates into trust, especially when you have to do something that impacts their lives and puts them at risk. So, and puts them in your skilled hands. So it is something that I've been blessed with a little bit, but it's always nice. Meaningful conversation is always good. And
so
it adds to things.
It adds a lot of value. So you wind up in college?
So beginning with that, my dad was pretty influential in trying to think about med school, and I had kind of made up my mind that I wanted to be a physician actually before I graduated from high school.
Oh, we did. Okay.
And so I got into two colleges that I wanted to go to. I got into a few colleges, but really the main one I wanted to go to was College of Charleston, because I had spent so much time in Charleston, loved being there, and had a bunch of roommates from high school that wanted to go there, had a dorm room and everything.
Had family, sisters and stuff went there too, right?
Well, that's the kicker on the story. So I basically was all set to go, set up in the dorm room, and my dad's like, he's like, dude, he went to check out the place and saw how fun it was. He goes, you'll never make it into med school if you go there. And so
Dad's last chance to have an impact on your life.
He did. So he pulled the rug out on that. And one of my good friends was also going to Millsaps College. So I went and interviewed there. Yeah. And I had played tennis for Baylor too, so they were very interested in me. And so I got in there, and it's an excellent academic school. Right. So was excited about it. He was like, just give it a year. If you don't like it, we'll let you go back to Charleston. I was like, all right, Dad. If I do, I want a sailboat on the I want to be like Don Johnson.
Yeah. We're dating ourselves now.
Yeah, I know. Exactly. And so that was the deal, but I ended up enjoying it. It was a fantastic educational experience. So was there in Jackson for 4 years, and basically, got my major in biology and chemistry. Anthropology was the other one. So I was.
Oh, you're triple major?
Yeah, they wouldn't let me triple because of I'd have to write it. I've had to write a thesis in anthropology, but I had the hour credits.
Yeah.
I really enjoyed anthropology, and so I spent all my additional credit time in a liberal arts college to get that.
You're like the real-time radiological Indiana Jones.
Could have been.
Yeah. Yeah, I could
like
see
soccer too much.
Oh, yeah.
So.
And then, so from there, you knew going into college, you were from high school, that you were going to choose a career in medicine.
I did.
Did you know you were going to be a career in radiology?
No, did not. I liked radiology. I liked anatomy. I liked the complexity of it all. I like to solve problems, and you get a different problem thrown at you very frequently in radiology. So it's not boring in that aspect. So it was something that fascinated me, and so through college, I basically made sure I took all the advanced courses I could so I could do well in med school.
And then you're doing great. You are going to go to medical school. Many people may not know this, but you went to Beth Israel, right?
Yeah, Beth Israel Deaconess. One of
part of the Harvard health system in Boston. I'm sure you got into many places, but that's the place you wind up landing, putting your feet down on. And you were there for how long?
I was there for 6 years. Almost 6 years. I'm trying to think because I did 2 fellowships, but I knocked those out in almost a year. But
what were the 2 fellowships you did, or what were the 2 skill sets that you get?
So diagnostic radiology is a 5-year residency, but I did my 1-year internship elsewhere, surgical thing, and so it was just total of 5 years in Boston. So. And so I completed my radiology residency there at Beth Israel Deaconess in Boston, which was my number one choice. I really enjoyed it. And then I ended up doing an interventional radiology fellowship for the subsequent year. But in between that, you can take if you finish a lot of your credits, and it's very common now, but it was pretty new back then. If you finish a lot of your courses early or do very well or pass these certain tests, you can do a mini fellowship.
Okay.
So I did that in musculoskeletal. Okay. Which is sports imaging.
Right. Because you were big into soccer. Yep. You're like athlete. You're like, okay, I want to be part of the sports medicine world as well as a radiologist.
Yeah, and it was cool because I love soccer, and so that was one of the things that I did a lot of when I lived in Boston was play a lot of club soccer. But New England Baptist is the hospital that has all the athletes. So, I moonlighted there plus fellowed there. And so I would, get to interact with, the Boston Red Sox.
I was going to say, who are your famous athletes you came across?
I saw their x-rays. And well,
home run hitter of the year.
It's funny you say that, but, there is a snapping tendon syndrome on an ankle that a certain pitcher had, where you might have saw blood in a World Series thing on the edge. That's where the perineal tendons snap anterior to the lateral malleolus and come back. It's a tear of the superior perineal retinaculum, and yes.
Is that a career-ending?
I can't mention names.
Yeah, no, of course not.
So
career-ending injury, no, but it has to be out for the season, probably.
Well, yeah. I don't know how it was surgically treated, but typically they'll tack that retinaculum down so they don't snap forward.
So at this point, your dad has this large radiology practice down here, or had helped founded it, or helped be part of that process, and that's growing, and it was just a natural fit for you to come into this practice, or how did that work out?
It was, and the fact that I wanted a practice that was, as you said, a private practice and very independent, so you could practice medicine the way you wanted to.
And why is that important to you? What makes you and I different than some of the larger corporate employed models? I have my philosophy on it. I think we share something similar. I think is we like to think technologically, more innovative, move faster, quicker, more personal care. I mean, why was that important to you?
I mean, pretty much all the things you said. Yeah. The key is those things are important to me, right? You want to deliver high quality care. You also want to deliver a good patient experience. So when you use quality, it's going to be related to, the accuracy of the diagnosis, the quality of the equipment, the patient experience, which is related to them walking into the door and when they, are completed with their examination. And if you're in private practice, you can impact every touch point where the patient is associated with your care.
Right.
If you're in a healthcare system, you will be able to control your personal interaction with the patient, but you'll have as you move away from that, you're going to have less and less impact. So, you might have some impact while they're in your office, but less so when they go out. Like they might have problems with the billing company that makes them so mad at the healthcare system you're in, or might have a very hard time getting in to see you, so it takes months to see you. And if you have cancer, waiting is horrible.
Right.
And so,
and that's important for us, particularly me as a lung doctor, lung cancer, and dealing with you guys as radiologists. Efficiency of care and delivery of state-of-the-art quick care makes a difference for not the patient's impression, certainly the quality of the care, or the ability to deliver timely treatment plans.
Yeah.
We get a lot of feedback about how important or how wonderful it is, really, that our patients can see us on, let's say, on a Monday, and I can walk them right down the hallway on the same day to get their CT scan. Or I have a relationship with a radiology group that is cost them less, honestly, if they're price shopping and comparing. So a lot of patients are much more smarter with the economics of medicine now, and ask me questions. Well, how much will it cost me to get a CT scan in the hospital compared to over here? And I say, well, I don't know all the costs. I just know that all my patients' feedback is for them it's much cheaper to be here. And by the way, I can do it on the same day generally, maybe the next day. But the hospital is tremendously, sometimes the larger organizations, more expensive. And so it's not only economically better for the patients, it's quality and satisfaction is higher with them. And it helps us out because we deliver better care.
Absolutely. From an imaging experience or any outpatient experience, again, there's a convenience factor that comes into play. Yeah. And then a lot of times we can control the quality. Frequently, our technology has always been leading edge in the Chattanooga market. And so even with the hospitals that have more funds.
You were the first radiology group in town to have what?
Digital mammography.
Digital mammography.
PET.
First in town to have PET scan.
PET CT.
We
actually had a PET CT. We were the first private practice group in the Southeast to have.
In the Southeast.
To have PET CT.
That regional
We
impact.
actually had PET CT before there were even CPT codes to bill for it. So we've always been leading edge. We were the first digital mammography group in Chattanooga.
And
the first National Center of Breast Excellence in Chattanooga.
Yeah. So you have what else? When I look at the list, I'm like, first of this, first of this, first of this, first of this. But it also, it's not just being first. It speaks to the fact that when you came, you're settled down now here in Chattanooga, you're a radiologist, but you're not just a interventional radiologist extraordinaire. You're also a fluent businessman and insightful with innovation. I feel, and I don't want to speak for you, that you just have a unique ability to sense what's right to do for the future and seize on technology, which is what we're trying to do as well, to move organizations forward and deliver better care always. And you seem like you're always ahead of the game than all the other places. Where did you learn that from, or how did you? Is that just innate, like your ability to speak with anyone who's 80 to 80 years old, or is that something that you made an effort to learn at school, or how did that happen?
It's probably a combination of both and some luck as well. When I was in Boston, I had a pretty strong IT background coming in to Boston. Yeah. Basically, video games. They'll teach you how to program. If you don't like the way this is, you work your way around it, and then so you learn, and then you also can get certain advantages if you can set up your network more efficiently. Mm-hmm. A lot of those skill sets translate very well into radiology. So when I went to Beth Israel Deaconess in Boston, the current CIO got a chairmanship at one of the smaller Harvard hospitals outside of Boston. And so they needed somebody with some knowledge of this. And I was the only person that kind of spoke, geek, IT,
right.
and then radiology, medicine.
Yeah.
And so I went along to a lot of these meetings with somebody who was a business guy. And so they were basically like, all right, I'm the guy, I'm the figurehead, I'm going to be the vice chair and the CIO, but dude, you're going to have to advise me. And I'm like, well, you're going to have to teach me about business and teach me about organizational skills and all this other sort of stuff. So, I mean, it was kind of a quid pro quo, but it was a good trade. And so I did that for 4 years of the 5 that I was there. So,
and then that is translated into, one of the unique things here is the fact that not only can I walk our patients down to the imaging, but we have, I think you were one of the first people who had an app for the phone that I could access imaging on to look at my patients. Imaging, maybe I'm at home at night or I'm traveling and giving a presentation anywhere in the nation. I can look at the imaging that I did yesterday in my office that you did for me, and it's on my phone. And then you have a data center here that's huge.
Ironically, so you talk about that, I won the Rinkin Ray Award. It's a national award based upon porting our educational material into a CLIA, which is a PDA. Remember there's so many CLIAs?
Yeah. The iPack. I remember having one of those.
So I used a web crawler to parse our website. It had all the educational material, which included images and everything, to allow it to be read offline, because nowadays we all have cell phones. You can access all this technology instantaneously. So I would do live updates and push those files to those when they had wireless access, and then it would keep the content completely updated, including schedules, everything. And so, and it helped the educational piece, because if residents are trying to learn, they have quick access. Like we take advantage with Google now.
Right.
Yeah. They just had access. They could search and actually search these Harvard archives to kind of get case files and everything else.
Yeah, I can remember.
And so to improve the educational experience, and it was kind of cool. So
you're cutting edge. One of the things I try to bring to the table in these talks are your impact on medicine and your impact today. And what I would emphasize, and I think, is your impact. I'd like to hear what you think, but for me, what I view is you and your group with digital radiology is you bring firsts to the city of Chattanooga, to the community, the Southeast region. You're first here, you're first there, and you're an innovator, bringing more firsts. What's the next first that you're going to bring here in the next 6 to 12 months? What do you think? What do you predict will be your impact on medicine in the next 6 to 12 months?
I always have good ideas, but usually I don't share them until I'm
Smart man. That's a smart entrepreneur right there.
I like people to go, dang.
Well, I think, no, that's important. I think technology is shifting so rapidly that you and I are always, I don't want to say experimenting, but we have the unique ability in the positions we're in and the practices that we run to try new things and see if they work and deliver better care and are better for the patients, make our jobs easier to deliver health care. And some of them work and some of them don't. Right. But we try them, and we're always trying to make an impact on. So
that's one of the benefits of private practice, like you said before. As you practice and you gain experience and your knowledge, and if you are entrepreneurial and you are thinking towards the future, you'll say, okay, maybe there's a better way to do this.
Right.
And then you may ask around or see if there's somebody out there who's a cutting edge person or a leading edge or the pioneer themselves. Right. And you try to learn from them and see, okay, boy, that actually does look like that's going to work.
And
let me put that in place in my practice. Let me see what's going to happen. Let me try that. And we're not talking about experimental technology or anything like that, but something to improve access for the patient or the speed of the procedure or reduce the risk of the procedure, something along
For
those
example,
lines.
I know that my patients have been very appreciative of that, the ability for us to offer options. And when I tell them, we do an informed consent, which is the process of talking to the patient about what the risks and benefits are. And then I outline them the reasons why we like using, you, and they often ask, well, why am I going over here? I said, well, we do things differently there, and these are the capabilities that will reduce your risks. And it's always the feedback from patients is great, and they always feel a little bit safer knowing that they're in good hands. So that's, I think, that's impactful our day-to-day process. I mean, I think that's your impact on medicine is the.
We try. I mean,
first.
It's always we always try to push the envelope with quality. And technology impacts a lot of radiology quality. The individuals as well. So we all try to do subspecialized reads, and we were the first in the world to have a completely integrated solution for radiology. The first Singo Suite. That was back in the late 2000s. And what that did is
another first.
it allowed us to read like a Harvard. It would, we're a smaller radiology group, but we could read subspecialized reads in the late 2000s, and we were blessed to live in Chattanooga, which has such bandwidth that we could move images around Chattanooga.
I mean, before we were known
easily.
as the gig city, it had T1 lines, T3 lines, all the important pipes, and the EPB Fiber, which is a very innovative company as well, which I'm trying to get their CEO, who is my neighbor, to come on our show, talk to him about the importance of high bandwidth.
We were their spokesman because we were a great poster people for medicine and how it actually impacted medicine.
I remember seeing your picture on one poster one day when I first came into town. I was like, look, that's the guy I just leased my space from. He's on a commercial for EPB talking about, EPB bandwidth or whatever the thing was. Well, that's awesome.
It's true. It really did impact patient care. I mean,
and that's what it's all about, is how do we impact quality of care, patient care, and I like having fun. You say we're not experimenting, but I like having fun trying new things that bring something less risky or decrease their mortality, improve their treatment options for my patients, and I'm willing to try it, and I think it's great. Couple of things we like to say, recommend it. What's your favorite book that you'd recommend to anyone to read?
One of my favorite books, it's always stuck with me, is a book that I read as a child called Ender's Game. So I really enjoy Ender's Game. It's a really cool book about. They made a movie about it, which the movie is okay. It's a little disappointing if you.
Most movies are like that, though. The book is always better than the movie.
True, but it's cool in the fact that it's just a child as they transform into more adult type responsibility. Yeah. One thing I really like about Ender himself, he's a problem solver, and he can think about problems outside of the typical dimension. So if you approach a problem from a different vantage point, a lot of times you can come up with a more novel and successful solution.
Yeah.
So
it reminds me of the movie Wrath of Khan, where Captain Kirk and Spock are sitting there and they're about ready to get destroyed in the nebula, and Spock says to the captain, "Well, if you Khan thinks two-dimensionally. You need to think three-dimensionally."
It's true.
And that's when he takes the USS Enterprise, and instead of moving in an XY axis, he shifts it and floats down on a Z axis. And then Khan doesn't know where he's at, and he pops up behind him, destroys him. Great movie.
Fantastic.
Speaking of which, name your favorite movie. Best movie you ever seen. Favorite one.
Empire Strikes Back.
Oh! Here we go! I knew I was hoping you were going to say that, because
you know me too well.
I know you well. We're big fans. I'm not sure if you can see in the back here of I'm a big fan of the Millennium Falcon. Empire Strikes Back is my best Star Wars movie as well. Although I think Last Jedi was pretty good. It got a bad rap. I really like it. The Force Awakens was pretty good, and I actually like
Rogue One.
I actually like that movie. Of course,
very good. I like that a lot.
Spoiler alert, of course everyone dies in the end, but it set up the story about how they got the Death Star plan, so I thought that was really cool.
It's funny you mentioned that the scene that you liked about the Wrath of Khan, which I also love that as well. My favorite scene in The Empire Strikes Back is where the Falcon, of course, can't go to hyperspace. So it's sitting there, and it's trapped between 3 Star Destroyers, and they're all on the XY axis.
Yeah.
And then all of a sudden he's just like, all right, forget this. Boom. And just drops into the Z axis, and the whole scene kicks off.
Yeah,
so it's really cool. You can't beat that.
And that's how we always think. In medicine, I like to think we are problem solvers, and sometimes you have to think in the Z axis.
It's very true.
Right? And finally, just kind of wrapping things up, I always like to end by talking about, your legacy story. And it's a serious topic, I guess, because what I like to say is, what is our legacy? What would my legacy be when I'm not here anymore? I want people to remember something about me. Certainly my wife and kids will. And that family unit is extremely important. But I like to leave a lasting legacy of some sort. And I think knowing you and seeing your family, your dad, Joe Bush, world renowned. Now he's got this unique expertise. I think he's probably top 5 radiologists in prostate cancer worldwide. So you already have you have big shoulders to stand on already, or big coattails. But what do you see your lasting legacy for your impact in radiology in this community or the region, the world, moving forward? Or what would you like to see happen? How do you? I think you've already left a legacy, honestly. But what do you want to achieve in the future?
Well, in some ways, I think I'm a little too young to kind of know what my legacy is going to be.
Right.
I mean, I'm probably midway through my career, I hope, in that form. What I do know that I've always kind of strived for is to try to strive for excellence and always be better. Everyone makes mistakes, but you always try to learn from your mistakes and not make them more than once. And so I think that's how you continue to strive towards excellence. And so I always try to have that culture around me and try to infect other people with that kind of belief, because teamwork, another thing I've learned with another passion of mine, which is soccer, is that a team is stronger than the individual. And so I really enjoy seeing a functioning team, because the sum of the parts, the team is more. Is
some of the parts is bigger than the whole. It's kind of like I like to refer to Steve Jobs. His kind of thing was think different. I know that was a commercial, but that was his impact. I still remember that commercial, and it's to think different. And then you have Martin Luther King, who always said, like, to the mountaintop. And so, I hope for you and for me, one day people will think of us and say, have some phrase that they remember. Oh, to the something, and they go, oh, that was Jim Bush.
Who knows?
Who knows? But I think we're doing great things for patients. I appreciate you being here tonight. The opportunity to talk to you and explore a little bit deeper about who you are and how you got here. And I just want to say I thank you for being a part of our practice. And I think it's fun working with you, and I think we do great things for our patients, and I look forward to doing it more in the future. But other than that, let's go out and have some dinner, and we'll wrap this up.
It's good teamwork, man.
Thanks.